With disaster nipping at its heels, Alberta's health system keeps adding beds. Provincially, the ICU capacity has now more than doubled, but every day more patients arrive with COVID-19.
I'm changing my own behavior. I'm encouraging family members to change their own behavior, because when you call on the healthcare system, there may not be the capacity for it to actually be there for you.
With Saskatchewan facing a similar surge, the Canadian Medical Association is calling on both provincial governments to do more. The crisis can no longer be solved by vaccine alone. What's needed, they say, is a lockdown.
People are dying, at ridiculous rates. The amount of suffering is catastrophic, and healthcare workers are completely burnt out.
After dismissing calls for a firebreak lockdown over the weekend, Alberta's premier admitted Tuesday that more restrictions may be needed, just not yet.
We want to take a look at the data as it emerges over the next several days to ascertain what impact the recent round of measures has had. It's too early for us to make that assessment.
If current restrictions do not work, Kenny says provincial modelling suggests Alberta could run out of ICU capacity late next month. Saskatchewan hospitals are facing increasing pressures as well. Both provinces have had to cancel most scheduled surgeries, and Saskatchewan has paused its organ donation program.
This halt of this program affects Canadians nationwide. This may very well result in more patients dying while waiting on the transplant list.
A terrifying thought for this Calgary mother of three.
It just means more waiting and more, my symptoms get worse, my eyes get yellower, my bruising gets worse, my ascites gets worse, and the waiting gets longer.
As the COVID surge on the prairies becomes a total healthcare crisis, there is still no foreseeable end. Heather, Yourex-West, Global News, Calgary.